Hello, good afternoon, good evening, and good morning to everyone joining to our weekly live Q&A on COVID-19. Today's focus is on COVID vaccines, and I'm pleased to be joined by Dr. Kate O'Brien, who I'm sure you already know. She's our Director for Vaccines, Immunization, Vaccines, and Biologicals. I've said this title many times, but I'm always confused. Good afternoon, Kate. Thank you for your time for joining us today.
Really pleased to be with you again.
Thank you. And I would just remind our viewers, if they are watching us on Twitter, to use the hashtag AskWHO to send their questions. If you're watching us on other platforms, please use the comment section as usual, and I will pass your questions to Kate. Kate, while we're waiting for viewers to start sending their questions, we are in the third year of the pandemic. COVID vaccines have been administered around the world for maybe a year and a half now, and billions of people have received them. Can you tell us maybe more precisely how many people have got their full doses and maybe single doses or boosters? Some statistics around vaccination, but also how this tool has helped us to drive transmission and down and to control the outbreak.
Yeah, it's, when you said that boy, we're in the third year of this pandemic, it's kind of hard to believe sometimes. And I think for everybody, we can well believe that we're into the third year of this pandemic. And as you alluded to, we've had authorized vaccines now since December of 2020. Which is also kind of incredible to realize that we're about 18 months into the use of these vaccines in practically every country around the world. And we have now, as of yesterday, in fact, over 12 billion doses of COVID vaccine have been administered. And maybe it's a bit hard for people to kind of get their head around that number. So if we just compare to all the other vaccines that are given to children, to adolescents, pregnant women, adults, and older people, there are about 5 million doses on an annual basis of non-COVID vaccines that are given around the world. So we know a lot about these COVID vaccines now. And what 12 billion doses means is about 65% of people around the world have been vaccinated with a primary series. It doesn't mean that it's equal in every place around the world. So for people in low-income countries, fewer than 20%. We're still at about just a little over 10% of people in low-income countries have been vaccinated with their primary series, and that compares with almost 75% of people in high-income countries. And that really is attributable to what happened in 2021, which is there was such constrained and inequitable distribution of the supply that when people really, really wanted to be vaccinated in every country around the world, vaccines just weren't where they needed to be in an equitable way. And now we do have full supply of vaccines, so countries have full access to vaccines, and real focus is being put on making sure that people who are at highest risk of disease are getting vaccinated. So I think healthcare workers are one of the most important groups, along with older adults. And over 70% of the world's healthcare workers are now vaccinated, at least with a primary series. So that's really good news.
Thank you, Kate. And I thought maybe we'll go into this at the end, but maybe we can reverse the order and speak about this 70% target. WHO has set a year ago that we wanted to see 70% of population in every country vaccinated by mid-2022. Seems that we are far away from that target. What are the risks and consequences, and what worries you the most about that inequity?
Yeah, well, that target had a really clear reason for the target. And that clear reason was, and continues to be, that in order for every country to be safe, for every person to be safe, we need to protect people from getting severe disease. And the 70% number, what it reflected was the goal to vaccinate every adult and every adolescent in every country. And so we now have 58 countries that have achieved more than 70% coverage. There are about 126 countries that have gotten over 40% coverage. But what it also means is that there are 20 countries that are still below 10%. And that means that in countries where adults and adolescents have not been vaccinated, it means that they're still at risk not only of severe health consequences, but also the potential for social and economic disruptions that we've seen so much of around the world. And especially we worry about the emergence of new variants of concern coming into populations that have not been vaccinated in any substantial way. Still, when we look at people who are hospitalized for COVID, the vast majority of them are unvaccinated people. So this pandemic isn't over, and people continue to die from COVID unnecessarily because they're not vaccinated, and continue to be hospitalized, again, preventable if people would get vaccinated.
Thank you, Kate. And you mentioned in some countries people haven't received any doses, some people received one dose, and then in some other countries we are seeing people are receiving third, even fourth or fifth booster dose. So one of our viewers is asking about booster doses, who should receive them, and how many booster doses a person should take.
So booster doses are an important part of a complete schedule of vaccination, and people should follow the recommendations in their country. And different countries have slightly different policies, but from a WHO perspective, we look at the evidence across all countries and all products that we have WHO emergency use listing on. So our recommendations are that a complete schedule of vaccination is a primary series plus a booster dose. And then in people who have underlying medical conditions that put them at really significant risk, especially those who are immunocompromised, an additional dose is recommended so that because people with immunocompromising conditions don't respond as well to the first primary series that they've received. We know that there are recommendations in some countries for additional booster doses, and we've been looking really carefully at that evidence. The evidence is not convincing that this is of substantial benefit, and so we do recognize that there are some countries that are recommending additional booster doses. We're not recommending that as a general policy at this time, and we'll continue to watch that evidence really carefully.
Thank you so much, Kate. Some of our viewers are already sending in follow-up questions, and in this current context of Omicron and its sublineages, are the current vaccines still effective?
What a great question, and I think so many people out there have gotten to be experts on all of these naming of the different variants and the sublineages of the variants. What we know from the data that are coming out, so these are studies in different countries that are telling us how well the vaccines are working when they're in real-world use. And we see that, especially for the sublineages of Omicron, so the evidence that is available says that the vaccines are working just fine on the sublineages, especially for that severe end of the disease spectrum. But what's really important about Omicron and about these vaccines is you really do need to get the booster dose in order to maintain and sustain the protection that you have from the primary series. I think the second thing to say is that the vaccines that we have, all of them in fact, have much less protection against mild disease or asymptomatic infection. And so the benefit of the vaccines is really most important for preventing you from getting really sick. And there is some protection against infection. There is some protection against mild disease, but it doesn't mean it's 100% protection. In fact, it's quite below high protection. So it doesn't mean just because people may be getting infected or getting mild disease, that doesn't mean that the vaccines aren't worthwhile. They're still very worthwhile because they're keeping people out of hospitals. They're keeping people from dying. They're keeping people from having severe disease.
Thank you so much, Kate. We are also having a question from Dirai Karki, who is asking about WHO recommendations of vaccination of children under 12 years old, and also do we recommend booster doses for children?
Yeah, so the benefit of vaccinating children is predominantly, again, these vaccines are mostly working against the severe end of the disease spectrum, and it's great that for kids they're much lower risk of having severe disease. And so we do have a product, it's the Pfizer product that WHO has emergency use listed and provided a recommendation for use among children down to 5 years of age. We also have recommendations for other products in the teenage years. But I want to emphasize that this age group is not the priority group to vaccinate. As countries are strengthening their programs, we're really wanting countries to emphasize and put most of their resources into assuring that older adults, especially the elderly, are vaccinated. And once that effort has been made and success has been had, moving down into other adults of other ages, and then down through adolescence, and finally children. There in different countries there are recommendations in some countries for immunizing children regardless of whether they have underlying conditions. In some countries, the immunization recommendation is restricted to kids who have underlying conditions that would put them at severe disease. So that's where we stand on this, and we're continuing to watch the evidence on vaccinating children.
Thank you so much, Kate. We have received, sorry, there's so many questions popping up here. Yes, some viewers are commenting of reduced access to vaccination at the moment and where they should get their booster dose. So when access to vaccines was established last year, there were aggressive campaigns that people can get their doses everywhere in shopping malls and like pharmacies, corners, etc. of their cities. So do you have any update on that, where people can look for vaccination if they want to get additional dose, and maybe why it happens that countries do reduce access, or it seems for public that the access is reduced?
So in some countries that have achieved pretty high coverage of the primary series, they're adapting the program so that immunization with COVID vaccine is now integrated into other primary healthcare services. So that means that, as you said, some of the big venues, either sports stadiums or religious institutions that where we were using big buildings to provide sort of mass campaign access, have now been modified. They've been stood down, and most people can get vaccines through their sort of usual primary care services. That may be routine immunization clinics that are providing immunization for children, adolescents, and adults for other purposes. It may be your primary care physician. It may be other public health clinics, depending on what country you're in. But countries that have provided access to COVID vaccines, we don't know of any country that has stopped providing access. So the vaccines continue to be available in all countries that we're aware that they're available in all countries that have started COVID vaccine programs.
Thank you so much, Kate. Here is a question from Jamuyang Yutan. I have done my third dose with all different vaccines. Any side effect of that? So I guess the question is about mixing and matching different doses and vaccines.
Yeah. So in usual vaccine programs, non-COVID vaccine programs, countries would most often purchase a single product. For COVID vaccine, because of the shortage of supply last year, countries have been having multiple products in their program. And actually, we've learned some really interesting things about that in fact, your immune response is often better if you mix and match. In other words, one dose with one product, a second dose with another product. So we have provided recommendations on what's referred to as mixing and matching. And there are a couple of products where the order in which you get the product does matter. You get a better immune response if the order is one way or the other. But in general, you can mix and match your doses. And we actually encourage that because it first of all, it facilitates the program. And secondly, we do see some improvement in the immune response as a result of mixing and matching.
Thank you, Kate. Here's a question from Katia Hassan. Is the vaccine efficacy decreasing over time? In other words, do we need to take a vaccine annually or once in a lifetime?
So another great question. Yes, for all of the vaccines that are available, there is a decline in the immune response and the performance, the protection that you get from the vaccine over time. And when I say over time, I'm talking about over months period. We're talking 3, 6, 9, 12 months period. We're not talking about days or weeks. And that's part of the reason why we do recommend a booster dose. And we especially recommend a booster dose in the era that we're living through right now, where Omicron, this variant Omicron, is the variant that is pretty much in every part of the world. We especially need booster doses for that reason. What we don't know is how many booster doses are going to be beneficial, and we certainly are not at a point of recommending an annual booster dose. And we're going to continue to watch the evidence, and especially for people who are in the highest risk groups. Having subsequent more than one booster dose, again, I'll just repeat, something that we talked about a little bit before is we don't have very good evidence on whether or not those repeated booster doses are going to really provide benefit. So this is still a matter of unsettled science, and we'll provide updated recommendations as we continue to watch that evidence. We do have some countries that have instituted repeats of the booster dose. And what we see is that the benefit of that second booster dose, or in some cases a third booster dose, is very short-lived. And so it's really this trade-off of how much benefit you get from it and for how long. And therefore, for us, it would really, if we make a recommendation, it will probably be restricted very much to those people who are at highest risk.
Thank you so much, Kate. Here's a question from Samar Misra watching us on LinkedIn. He's asking about do vaccines prevent long COVID? Do we have any evidence of that?
Yes, there are some studies coming out now that are showing. Now, there's a mix of studies and a mix of results, but we do see a series of studies that are starting to show that being vaccinated is protective. It does provide some protection against getting long COVID. I think most people know that you can get long COVID certainly after having had severe disease, but you can also get long COVID after having had mild disease. It's more common the more severe your disease is, but it's still present for people who have even had mild disease. So this is another benefit of being vaccinated, is not only protecting you against severe disease, but also protecting against this quite unique and unusual consequence of COVID called long COVID.
Thank you, Kate. You spoke about effectiveness of a vaccine, and here's a follow-up question from Shauna Kargan, also watching us on LinkedIn. Can you clarify if the vaccine or booster can prevent infection against COVID or only helps to decrease potential for serious disease or death? You did just mention low prevention against infection from vaccine. How does this compare to prevention against future infection after having had COVID?
Yeah, great. Another great question. Boy, these are great questions. So the vaccines do protect you against infection. My point is that the magnitude of that protection is not as high as it is against severe disease. So after your primary series, there's about 50% protection against infection. By contrast, after your primary series, depending on which vaccine you get, somewhere between 80, 85, 90, 95% protection against severe disease. So yes, there's protection against infection, just not as high as the protection against severe disease. Over time, we do see waning of that immunity, both for severe disease, but more waning for mild disease or infection. And that's where the booster dose is really important. The booster dose does improve, brings you back to where you were after the primary dose for both infection and for severe disease. And that's why there is benefit not only for severe disease, but also for infection and therefore transmission.
Thank you so much, Kate. Here's a question from Jayakumar Padamanba Pillai. Apologies for my pronunciation. I think he's watching us on Facebook. Is there any research is there any research in progress to increase the efficacy of existing vaccines to protect people from COVID and its variants? Kindly confirm how many vaccines are in use now.
So, there are lots of new vaccines that are efforts being made to develop them and to evaluate them, to test them, to see if they will improve the performance over the vaccines that we already have authorized. There are over 160 candidate vaccines that are in development, and some of the things that those vaccines are trying to improve on are the performance against infection. Certainly trying to improve also on the total performance. We don't have vaccines that are 100% effective. In fact, no vaccine is going to be 100% effective in 100% of people. So lots of vaccines in the pipeline, including vaccines that are specifically looking at increased performance against variants. And trying to broaden out the immune response so that perhaps those vaccines, even though we don't know what the new variants will be, maybe there's a way of broadening out the immune response so that against any variant that comes, we have improved performance. So that's the sort of situation with the pipeline, including trying to look for vaccines that don't have to be injected. So nasally administered vaccines is an example of more of the research that's being done to also make deploying vaccines an easier lift.
Thank you, Kate. A few of the viewers actually were asking about the nasal vaccine and when that vaccine can be expected for use.
Still in clinical trials, making progress, but I wouldn't advise anybody to hold off getting the vaccines that we have now. These other vaccines are quite a ways away.
Thank you, Kate. Here is a question from Lisa Bartlett, watching us on Facebook, about side effects of COVID vaccines. Is the COVID vaccine triggering thyroid issues like hyperthyroidism?
Okay, so COVID vaccines, like all injectable vaccines, do have some local side effects and side effects that involve the rest of your body. And these are self-limited, they are short duration, things like a sore arm, redness at the injection site, some discomfort on moving your arm for a couple of days after having been vaccinated. Also, in some people, headache, fever, or just not feeling well. And those are things that are common across almost all vaccines that we receive as injectable vaccines. They are self-limited. Symptomatic treatment is usually all that's needed to address those. For some of the vaccines, there are rare, more severe side effects that are now known. For some of the mRNA vaccines, some inflammation, mild inflammation around the heart, especially of more common in men than in women, more common in young men than older men. And for some of the other vaccines, also these rare, more serious events which have been identified. So important to understand that none of these are completely without the rare side effects. But again, the benefit of the vaccines far outweighs the rare events. And there really have not been descriptions of thyroid issues related to the vaccines, but there have been, one of the questions that comes up quite a bit in women is whether or not there's some disruption to menstrual periods, and a little bit more evidence coming out about short-term disruptions to menstrual periods, but no evidence that these have any long-term consequences.
Thank you so much, Kate. Here is a comment, but also question from Tari Melning watching us on Facebook. I am unvaccinated and I haven't had COVID-19 yet, but all vaccinated people I know got COVID-19 once or twice already. Can you help explain?
Okay. Well, first of all, for anybody who hasn't knowingly had COVID-19, good for them and good for their health. Of course, we do know that there are a lot of infections with the virus that causes COVID-19 that are in fact mildly symptomatic or asymptomatic. So I think it's fair for people to say that to my knowledge, I haven't had an infection, although there are many people who have been infected who otherwise were not aware that they've been infected. it's an interesting anecdote for an individual sort of everybody he knows who's been vaccinated that they've had COVID-19. That's certainly not a generalized observation. COVID vaccine is very protective against people developing serious disease and moderately effective against preventing infection. But I think what's really important here is that we're also learning that the immunity that you have against COVID is also improved when you have not only infection, but also vaccination on top of having been infected. And so that we call this hybrid immunity, that it's both immunity derived from being infected and from being vaccinated. So a question we get very often is, if I've had COVID already, is there any benefit? Is there any reason for me to get vaccinated? And the answer is definitely yes. We see over and over again in studies that for people who have infection-induced immunity, in fact, their immunity is even stronger when they get vaccinated on top of that infection. So again, being infected, having had COVID, is not a reason to not go ahead and get vaccinated. It's important to still get vaccinated.
Thank you, Kate. Here is a question from Yudi. What is the vaccine effects for women during pregnancy?
So women who are pregnant actually fall into the category of high risk for severe disease, not only for themselves, but also for their baby. We've seen that being vaccinated has reduced stillbirths by stillbirths of every and all causes by almost around 15% in a new study. And women who are pregnant and get COVID are at significant risk of having a severe episode of COVID, which has, in some women, led to the loss of the pregnancy. So we advise that women who are intending to become pregnant should absolutely be vaccinated, and if they haven't been vaccinated by the time that they're pregnant, it's fine, it's safe to go ahead and get vaccinated. So definitely women who are pregnant should either already have been vaccinated or should go ahead and get vaccinated.
Thank you, Kate. And here's maybe something that we need to clarify, because one of our viewers is asking, is it true that men don't have to vaccinate and only women have to get vaccinated?
Absolutely not true. Men and women are both at risk of significant severe COVID or mild COVID or moderate COVID. In fact, depending on what data you look at, men have actually increased risk of significant COVID, probably related more to how common it is for them to have underlying medical conditions. So there's really no truth to what this viewer has heard, that it's just women who should be vaccinated.
Thank you, Kate. So everyone, please get your dose as soon as you can. Here's a question from Lauretia Nitambi Motebelev. What is the risk factor when you have a heart problem or allergies and have to get vaccinated?
So people who have heart disease or who have allergies, especially any kind of allergy that relates to asthma or to their lung health, would also fall into the category of people who are at risk for serious COVID. And so those are people who would be at high priority for getting vaccinated. But certainly anybody who's in the adult age group or the adolescent age group, we're recommending to be vaccinated. And people like this, especially a priority for vaccination, including the booster dose. Really important that the booster dose is also given.
Thank you, Kate. Here's a question from Yana, watching us on LinkedIn. She says that unfortunately she had a serious adverse reaction to her one and only dose of a COVID vaccine with the long COVID symptoms. So she's asking whether WHO is looking into this type of cases.
So first of all, I'm sorry to hear that somebody has had an adverse reaction to a vaccine without knowing which vaccine we're talking about. But we don't see that COVID vaccine is resulting in long COVID. The Association for Long COVID is about getting infected the SARS-CoV-2 virus. So for people who have had, these rare examples, rare instances when people have a significant reaction to a vaccine, it's important to consult with your care provider, because there may be another vaccine that you can get. It depends which vaccine she received as her first dose, and there may be another platform, we call it, a different type of vaccine that could be administered in a safe way.
Thank you, Kate. And another question from Facebook viewer Sharmila. Why many girls are having problems with their menstruation after getting vaccinated?
You know, the research is going on to look into this, and what we know already from the research is that any disruption to menstrual periods is short-lived. It's not an ongoing problem. We don't really understand what it relates to, what the cause of it is, but it has been reported by a significant number of women who have experienced this, and that's something that we've picked up on. The research is going on to try to understand the nature of the disruption and what the relationship is, but we don't have a clear understanding of why it's happening exactly.
Thank you, Kate. And a few of our viewers were following up to what you were saying at the beginning, that we have countries with not enough access or not enough people being vaccinated. So some of the viewers are asking how we can increase access, in particular to health workers, elderly, and vulnerable people.
So we're working, WHO, along with our partners that include UNICEF and Gavi and other partners. We're working directly with countries to try to figure out what the bottlenecks are and de-block those bottlenecks on a country-by-country basis. So some of the kinds of problems that are happening is, first of all, we talked before about like where vaccination is available, and some countries probably need to expand the number of places where they're offering vaccines. So especially for adults who are super busy, taking care of their lives, making it really easy for adults and especially the elderly to get vaccines. So, starting to vaccinate elderly people especially at the place where they live, rather than asking them to come out and come to a vaccination clinic. Having places of vaccination in the usual places where adults go, buses, marketplaces, malls, other areas where adults are sort of out and about doing their daily business. So those are some of the things that are improving the way in which countries are able to provide more access, easier access for anybody who is wanting to get a vaccine. The second thing is people really understanding the importance of getting vaccinated. Although right now we are seeing reductions in many countries, we also know that countries are really stopping to test. And so some of the reductions, in fact, a large part of the reductions in the cases that are being reported is more because countries aren't testing anymore, as opposed to a real reduction in the cases. And then the third thing we know is that countries are stopping some of their public health and social measures. And we are definitely seeing increases in the number of cases that are occurring. And we want people to be safe. We don't want people being hospitalized, having severe disease. So all of these things are really important pieces of communication, so that people in countries who haven't been vaccinated understand the risks still in front of them, and understand the reason why it's important that they actually get vaccinated.
Thank you, Kate. And maybe a last question before we close from Kuding John, watching us on Facebook. What is the importance of vaccination?
Vaccination is about maintaining your health, keeping you out of the hospital, making sure that you are doing everything you can to reduce your risk of being infected and passing on the virus to somebody else. So it's about being safe, maintaining your health, staying out of the hospital, making sure that our economies, our social environments can keep functioning in as normal a way as possible. And what we're really seeing also in countries is that countries have been really hard hit from an economic perspective because of this pandemic. When you get vaccinated, you're contributing not only to protecting yourself, protecting your family, protecting people around you who you don't actually even know necessarily, and you're protecting the future of your family, your community, and an ability for all of us to get out of this pandemic.
Thank you so much, Kate, for your time today and great answers as always. And also huge thanks to our viewers from Nigeria, Indonesia, Brazil, Mozambique, the US, India, Belgium, France, South Africa, Argentina, Libya, Pakistan, Portugal, Sudan, Burkina Faso, Iran, Italy, and many others. We'll be back with you next week. And until then, please follow us across social media channels on vaccines information, but also other COVID information and other health issues and outbreaks. Goodbye.